Dr. David Kulla here. We have Shrab here who had surgery for hiatal hernia. And he had the laparoscopic surgery. Now, a lot of you have seen the videos I've done on hiatal hernia, and I always say that if you've had surgery, you probably shouldn't have the hiatal hernia maneuver done. It's higher risk. Obviously, they've gone in there, they've changed the structure of things, and depending on the type of surgery you've had, he had a laparoscopic surgery. It's a little risky to do this maneuver. It's probably safe. It's probably not going to cause any horrible side effects if something were to go wrong, but I'm always very cautious, and I like to side on the air of caution rather than risk. So that's why I say it's a contraindication. But Shrab here begged me to do the hiatal hernia. Begged me? I don't know if
I did.
Okay.
I did.
He did beg me. I don't remember. It was a couple weeks ago. We've done it how many times?
4 times.
4 times, and he's had a lot of relief, all right?
Absolutely.
So that's great. We had him sign an extra waiver, but he's aware of the risks. So we're gonna do it very gently here for him, but you can see he has a bit of a belly, okay? So he needs to lose weight because with the extra weight, that creates more pressure in the abdominal cavity because there's more belly fat, okay? And then also you're pulling the stomach down because of the core being weak, and oftentimes then the diaphragm gets weak. So he's lost some weight and he's going to continue to lose weight, and we'll get him down to about 200 pounds by the end of the summer, and then things are really going to be better for the long haul for him, and we won't even have to do the hiatal hernia maneuver on him. So we're just going to do it once here gently. I will say this, I have been much gentler with him doing this maneuver because he has had the surgery. And again, I always like to err on the side of caution. So, being gentle the first few times, we're not trying to move mountains here. So it's always better to start more gentle, conservative, see how the patient responds, and then, go a little deeper or more intensively at that point. And we've gotten really good results with him being gentle. So, and then he lost, how much weight did you lose?
A year, 100 pounds.
100 pounds in the last year. So he's still got some to go, and that's certainly helping. But how about in the last month or two, how much have you lost?
10 pounds.
10 pounds.
Yeah.
So he's lost an extra 10 pounds since all his hiatal hernia symptoms came back. Or were you having all these symptoms the past year? No, just recently?
Yeah, just recently.
Okay. So again, this is a contraindication if you've had laparoscopic or Nissen fundoscopic surgery. You want to be really careful having this done. Start gently, mildly if you absolutely have to, and you could probably do it yourself because again, you don't need to get in there too forcefully. It's hard to get in there forcefully on your own. So you might be okay doing it yourself. You can certainly try it and see if that helps improve your GERD, acid reflux, and heartburn. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.